Okay, good morning, everyone. This is Friday, October 24th, 2025, and it is 9:02 a.m. This is the Contract Review Committee. My name is Veronica Bolchik, and I am the chair. And this meeting is being conducted in a hybrid fashion, so all votes will be taken by roll call. So the first thing I'd like to do this morning is to establish a quorum. So up on the screen, I see John Balash,
John Balash,
Linda Williams.
Here.
Okay. Lee Tesser,
here.
and in the trailer room A, we have Suzanne Keating.
Here.
Good. And myself, Veronica Bolchik. So we have 5 members in attendance, so we do have a quorum. Joanna Roach sent a text message early this morning that she had an emergency off island and she will not be joining us today. So the next thing is we have acceptance of the agenda. Can I have a motion, please?
Make a motion to accept the
So
agenda.
moved.
Okay. Okay, Linda second, so by
Second.
vote. John Balash,
Aye.
Linda,
Aye.
Lee,
Aye.
Suzanne,
Aye.
myself. All right, we do have an agenda. I don't believe we have, what we also need to do is, we have 2 members of town administration here. So we have, Jericho Maley
Here.
and Alexandra Richards.
Here.
So, and now we go on to, public, but I don't see anyone on the screen.
Let me just double check the participants list. There are no members of the public.
Okay, thank you. So we can move on to that. Next thing is approval of minutes from 9/5 and 9/12/2025. Could I have a motion to accept those? There is a correction.
Moved.
Do I make the correction?
Alright.
You do,
Submitted.
yeah, is this you approved with edit as submitted? Linda, you're choppy now? Like I'm getting every third syllable?
I'm just gonna bring up the correction myself.
I'm in my
Okay.
uncle's house and I can't, and there are people sleeping here.
I gotcha, sorry.
Yeah, so do I do the corrections now or?
You approve minutes with, then state the correction.
Okay.
And then follow up on the motion.
Okay, so we'll have a motion to approve the minutes with corrections. So can I have that motion?
I'll make a motion to approve with the correction.
And then second,
Second.
Second.
so we'll do the vote and then the corrections. All right, so John,
Aye.
Linda,
Aye.
Lee,
Aye.
Suzanne,
Aye.
and myself, I. So a correction that are on both of these in the header where you have members of the committee, you need to update the members of the committee. Dorothy Hertz is still on there, so needs to be replaced with Lee Tesser. And Suzanne, you have a correction also?
Yeah, no, I can't get in. I've been shut off. I don't know if it's the
And
Wi-Fi.
that's for both of them?
Both of them. Yeah.
On the one that said for September 12th. Yes. I'm sorry. On September 12th, it said it's September 5th on the agenda.
Oh,
Okay.
I mean, on the minutes.
on the minutes,
Yeah.
okay. So if you can make those corrections, appreciate that. Alrighty,
It was right in the that she sent us, but on the actual paper, it said the 5th.
okay. Alright,
I think that should be working.
Okay.
Give me a second. I'm taking a
So,
probably long amount.
moving on to the next item on the agenda are the review and approval of the quarterly reports. Do we have any discussion on that? Alright. Here, I do.
Sure.
On sharing kindness, there was absolutely no detail. So we should have some detail. I know that was a new organization, but it just had request of funds, but unless when I pulled it up, I didn't see anything. Because I didn't print out everything because
There's a lot of it.
it's a lot of it. But I went back over and over and I only found it's like the header sheet and it just had their address and no detail at all.
Let me check what their reporting terms were, and I can request them to provide the reporting questions for the term in files.
Okay.
It says no internet, so.
Still?
And
Hold on.
well, you're looking for that, the second that jumped out because in these quarterlies, we had quarterlies from the Human Services grants for 26, substance misuse, and they also had a quarterly for the opioid grants.
Yep.
So, and on that, I have a question on Fairwinds on the opioid grant. I went back to read the grant that was awarded in June. And the indication was they were requesting money for peer recovery for the first quarter of 26. They've only submitted, they're treating it as though it's being used the entire year. So they've only requested 90.90 as opposed to the entire amount. And I was led to believe it was for the first quarter that they were gonna be putting an effort to expand for the increased need in summer.
So I will reach out to see if they can clarify their timeline for the peer recovery program that they applied for. It could be that timeline for starting it up was slower, although again, I was under the impression it was an ongoing program that was being expanded to cover that particular time period. So
Yeah.
I'll reach out on that.
The grant specifically said they were going, this was just for the first quarter.
Yeah, exactly. And it was bridge funding between two funding sources, I believe how they described it. Because they had the PRC services were not intending to stop at the end of the year, but they were going to a different funding source. And they had a period in which they could not cover the cost of it, and so they made this request to bridge that gap. So I'll reach out to Fairwinds to see what the situation is there. In the past, we have had invoices get split evenly despite services not being delivered, so perhaps there's some ambiguity there. I know that at one point that was a concern, was that you shouldn't expend all of your, people were operating the assumption that they shouldn't expend all of their funding, but they should be applying for reimbursement for any expenses incurred during that period, so.
They gave very detailed
Yeah,
there are pages and pages of, the contact with client and, the numbers of it, but it was just for first quarter and I was expecting that.
the full sum would be expended, right?
Exactly,
Yeah.
that's what the grant, how the grant was written, and that's how we approved the grant.
Or the opioid.
For the opioid. Right, so I'd like clarification, because. It's our job to
No, exactly, that's.
know exactly and what we're giving and when it's to be used and, I don't know if they are going to,
Be continuing this for a
if
year.
something has to happen on our end, that we would have to amend.
They would need to, they should submit a written explanation for why they're not expending all of their funding during Q1 as the proposal suggested. That would be something I would like for them.
Well, is a proposal suggested, or it's not really,
As the
we're
proposal
looking at, it's not
yeah,
stated,
sorry,
it's not, this is not a serving suggestion,
Yeah,
it's, if you tell us this is what you're gonna do, and it just.
No, you should be explaining any difference between your program and the proposal you made for the program.
Right,
Yeah,
Right.
all right,
and I didn't see anything like that, so I would like clarification on that before approving the quarterlies. Does anyone have anything else on any of the quarterlies? Okay,
and specifically, would you want clarification on that before releasing the opioid remediation
yes.
funding? The other two grants are accepted, okay.
Right, right. And on that other opioid grant, it was Artist Association, and that program, and it was written, it is not gonna happen till the winter time, so they just, put a statement that no funds were spent this month of the quarter.
For clarity going forward, we would prefer, if a program does not expend money during a given quarter, we would prefer that they submit a invoice for zero or like a report
Right.
form for zero, just so we have it in the rotator. Okay.
Exactly, and that's what
That's what
Artist
they did, didn't they?
Association
Yeah,
has
yeah,
done.
yeah,
Yes.
so like some agencies don't there's no consistent there's no consistent policy on our end for that. I've been telling people to do that, but I just wanted to make clear, would like a report in every quarter, whether you expend money or not, while you have a
Yes.
contract active.
Right, so there's a record that there's something from for that quarter. Right. I also, I know that we've discussed this and made some efforts. Some of the organizations are spot on and, tell us what it was that you spent money on, very clear, and others in reading these, it just, I found it extremely cumbersome.
There's some of them were really lengthy.
Yeah, yeah. And, I appreciate the effort they put in, but, it would be nice if this could be somewhat streamlined.
So from next year, we are going to use either the procurement software that finance has, or another kind of flow-based application process. So people will be entering information into specific boxes so that there's less free form going on, and that you at least will have to complete the core R Exhibit D, those
Mhm.
questions in the format that they're laid out. Because there were some interesting formatting choices, often that were quite good, but not the thing that we're grading them on when it comes to focus, which is accurately completing the
Exactly,
program.
it's, on some I learned more than I, necessarily, more than what we asked for, which I guess you get a for effort, but it just is cumbersome.
Yeah. We have been asked to use that procurement software for the last couple of years. It's not a great fit for human services grant program, so I'm gonna look around a little bit before. But there will be a more formal application process for next year.
Okay. All right, so what I think we need to do is, make a motion to approve all the quarterlies except for Sharing Kindness, which we need more detail on, and Fairwinds opioid grant. Quarterly. And we will hopefully get that by next week and we can add that onto an agenda.
Would you like me to make a motion?
Okay,
Or-
so I found the reporting form where they highlighted recruitment and registration progress qualitative. So my guess is that's the number, that's what they were doing for this particular quarter. I'll reach out and get, so in the reporting form, they have
recruitment and registration progress, which is something I asked them to kind of keep us in the
Is
loop.
that sharing kindness?
That's just sharing kindness. Sorry, I
Okay.
should have clarified that.
I could not, I didn't see that. I
Yeah.
just, it was,
No, that's okay. They didn't report any numbers. It doesn't appear to be that there's anyone in there currently, or they're not actively running this particular one of their
Okay.
parent groups, because this is only supporting one of the groups, one of the couple of groups that they're doing. But I'll reach out to Kim and ask for would you like a like brief qualitative assessment of how they're doing in recruiting, like where they stand in the program?
if that's there, I could not find it on my documents. I just saw the sheet and she had written in.
The invoice sheet, yeah, I
Right,
see.
and then, that was it, with no detail.
I'll show this to you
Okay.
after and see if this satisfies your request for additional information for sharing kindness. If not, it waits till the next meeting and we'll.
Okay, so what I'll do, we'll make the motion, as I stated, to, accept all except for the sharing kindness and fair winds, and hopefully at next week's meeting, we can approve those, so.
So
Susan,
I'll make a motion to accept the quarterlies with the exception of sharing kindness and fair winds till the next.
okay, and that's
A
fair winds.
second.
On the
Okay.
opioid.
And Linda has just seconded that, okay. So by roll call, I see Lee,
aye,
John,
aye,
Linda,
Aye.
Suzanne,
Aye.
and myself. Thank you very much. And, you know, we'll put it on the agenda for next week and hopefully we have answers on those, so
We can just put it up, follow-up discussion.
follow-up discussions, all right? Alrighty, so thank you all for attention to those quarterlies. And now, we're on to item number 6, which is reviewing the grant process. Just what we have coming up over the next couple of weeks. We've got, I think yesterday counted, we had meetings over between now and the 21st of November. So every Friday we are meeting at 9 o'clock. This is our heavy meat and potatoes time of year. So, thank you for, attending, and I am going to stress, barring any emergencies, please make sure that attending these meetings, because having, we have a 7-member board, but we only have 6 members at this point. We have, and,
Deliberations have that threshold.
yes, right. So, just gonna, jump ahead. Jericho just mentioned
Oh, sorry.
deliberations, but before I get to that, so it's, reviewing the grants, the way that we broke this now back in September is today, we're gonna be looking at the substance misuse grants. Next week, it will be the, program grants, and then the week of on the 7th is going to be the operational grants. For the substance misuse, everyone's been charged with reading these grants, and, we will discuss them in detail when we get to the next item on the agenda. For next week with the program grants, I assume everyone has, I have to have it in front of me in paper, and I assume most
Okay.
people.
I still can't get into mine.
I'll throw the list up and I'll give another try at that.
Okay.
I don't know, you should be in there.
Well, it says I'm in, but there's no
Internet, yeah,
connection.
thanks.
Okay, I can give you this copy if you want, just so you can see that.
Um,
All
We
right,
will,
that's just for the program grants. So what we've
oh,
done,
actually, I have this one.
okay, so,
It's for today's opioid. that I-
okay, so, this is talking for next week for the program grants. Because we did have, with all of the grant submissions, there's 23 applications. Next week is the heaviest, lift with 2, 4, 6, 8, 10. I've lost count on it, but you can see it's a heavy lift.
Yeah.
What we've done in the past with the program grants is we've assigned each member to go deep into a portion of them, and then we all will read them, but then we get back together. So, I'm going to ask if people want to do that again. I'm heavily suggesting that because of the volume and, so we have.
So basically pick, so we have 13 program grants, I believe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, sorry.
14.
So with 6 people, that's basically everyone takes one and a half each, but like
Right.
takes 2.
But if we do, two.
Or to focus on.
Right, right. So. If people can look at those, if there's anyone in particular that you would like to go deep in, I'll start maybe with Suzanne.
Yeah,
You can pick out 2.
sure, I marked down the 2 that we picked for me to do
Mhm.
through CHS.
Right,
So, I will do, let's see, where is it?
Are you on youth and substance?
Yeah, so, shoot, sorry. I can do, In the Herd
okay,
and, Lighthouse School.
Can you show the whole list at one time?
Yeah, I'm trying to
Yeah.
do that right now. Are you guys seeing the share?
Yeah,
No,
yeah,
Okay.
I just
Oh, that
skipped
didn't
you the
work at
full-
all.
The full list of applicants.
That made it
That's-
way worse. I'm just gonna make
that's
it.
worse. Just move it up on the screen some. There you go, back, sort of.
Do full screen. There we go.
yes.
Believe in you, Microsoft. I
I
believe in
already
you.
know my 2. I already know my 2, Star and AAN.
Okay, so that's Linda. Just show the Star and Artist Association. All right, John, do you have any preferences?
Well, only the ones where I don't have to go and try and crawl up some stairs. Or, I mean, in other words, are we visiting these or just looking at the?
Well, it's reviewing the application in depth, and if you have questions, you
Oh,
can,
I'll certainly I'll do elder services, which I've done
okay,
and I'm perfectly willing to pick up anything else so long as I don't have to go there.
okay.
How about Martha's Vineyard Community Services? Does anyone have a strong urge to do Martha's Vineyard Community Services?
Well, but I think some like Martha's Vineyard Community Service, I think, I don't know.
We can just do general.
We just
review.
done it, so I don't think we actually need to have that because we know that they're pretty well.
Gotcha.
So, all right,
BNA or Urban.
okay,
Memory Cafe.
I was gonna do VNA,
Okay,
Well, I can do residence at Sherburne, we're not doing that one.
well, no, I think Memory Cafe, we have to take a look at again, so would you like to do that one, John?
Sure, I'll look at that one, partly because, so coincidentally, I'm going to spend a 2-night stay out at Sherburne. My wife's
are you?
away, so I'll be in a position maybe to do a little on-site
Investigation.
Thank
We
you.
have to get you a Sherlock hat done.
Yeah, it'll be double brimmed, back and forth.
I'm sorry for digressing here, but there is a fabulous narrative done out of South America called The Mole. And it is a gentleman that takes on a task of embedding himself in a facility, and he's there to report for a family of, that there was no abuse, and it's just a lovely, lovely story. So, John, I see you becoming the mole.
Right.
Have a
I,
chance.
I'll,
Look it
I'll
up.
grow, I'll grow a short tail.
I saw
Yes.
that. That was a fabulous docudrama or
Is it docudrama? That's the
Yeah.
name of it.
Yeah, it was fantastic. And there's a more modern one, I guess you could say. Ted Danson did one. That's,
Oh, that's hysterical.
yeah, is that funny?
I
Yeah,
saw that.
Yes,
yeah.
yes.
What's that one called? The Ted
I
Danson one?
forget the
Yeah.
name, but it was fantastic. It was very funny. Oh my God.
I don't
Yeah,
remember the name either.
yeah, yeah. I think the mole was at the Nantucket Film Festival probably back during COVID when it was done virtual. I think that's where I saw that first, but it's around. So, John, we're gonna just call you the mole from now on.
Fine.
All right. So, Lee, do you have any that you would like to focus on particular here?
Really no preference. You can just pick two for me.
Okay. So. Well, let's see, I'm gonna take Pascon also,
So you're doing BNA and Pasco.
BNA and Pascon, and I think we're gonna need, so
Safe
let's see,
Place.
John, we have, a safe place. And,
NCTV.
you know, I'm looking at this. I'm a little bit confused now because I see New Hope in here, but New Hope is twice,
They applied twice,
really?
For substance and.
one for substance, one for program.
Well,
Oh.
and TV is twice also, aren't they?
Yep. AC Ambassadors is the general, and then
Yeah.
they have a specific substance misuse.
Yeah, because we're gonna be talking, they applied for 100,000 in substance and 78 here.
Right.
Okay, I have not reviewed these yet, so this is the first time I'm really focusing on this.
So we've had the multiple submissions to different categories before. We've never had that and the award cap. They're different funding sources, so there is no reason in theory why they're not coming from the same pool. But I think that's something we would have to discuss during either in a lead up to deliberations or during deliberations. That is a what is our intent question. There's no hard and fast guideline established as of yet.
Right,
I was
Um,
afraid this was gonna happen. This is why I was sort of really hesitant about doing it this way.
I think it's not a intractable problem. I mean, in all honesty, you know, the likeliness of them getting full awarded on both would have put them as the single largest recipient of CRC funds in the
Right.
history of the town of Nantucket, so I don't know if that was ever gonna happen, but we should work out a policy on how we want this
right,
to interact between the two funding sources.
Yeah, because
Um,
you're gonna get things that are both. And I don't know, are we considering either or are we considering money
cannot-
from both pockets? This
We
is
could-
what
we-
confused
we-
me.
We can introduce a cap also.
Yeah, and we cannot the funding from the substance misuse via the allocation and the guidelines, especially moving forward, will also contain some of the the collected opioid remediation funds and the settlement funds cannot be crossed with programs that are not specifically substance misuse based. So that is the only hard and fast rule we have on the crossover is that none of the funding that is allocated through substance misuse can be used for non-substance misuse purposes.
Right, but my problem was the program versus administrative. There would be people applying for both because they need both.
That's a different matter, isn't
That
that
one-
operational?
yeah,
That one we ruled out. That
Yeah.
one, you pick one or the other. Nobody
Yeah.
has applied for both an operational and a programming.
right.
Okay.
As far as I'm seeing on this list, it's New Hope and NCTV. Health imperatives, you know, they always have applied in both areas because they do have very specific programs for both areas, so I don't see that as an issue, but I don't think there's anyone else that's applied in both, except for NCTV and New Homes. All right. We will get to discuss New Hope when we get into the opioid conversation, and then we'll see what happens with next week with these programs. So let's see if I go down. So if I put you, Lee, on a safe place. And I think we're not doing Fairwinds is a capacity.
Yeah.
Is Health Imperative is a capacity.
Health Imperatives is not, they went for a programming grant.
They're programming, and Interfaith Council is capacity,
Yep. As is NAMI.
and NAMI, even though they did not do the full amount, they only went for 60.
Yep.
Okay, so we'll keep Fairwinds and Interfaith out, so when I go down the list,
Small Friends and Health Imperative.
NAMI, Pascal, Small Friends, and a warming place, so let's put you on Small Friends. So Lee, you'll have Safe Place and Small Friends, and then Joanna will get Warming Place. And
Where's that line?
Who's got Lighthouse?
I do, Suzanne,
Okay.
Health Imperatives is doing that.
Health Imperatives, that's
Is that Joanna?
I will have Joanna do Health Imperatives, okay.
Quick update, no award from this grant program will exceed 100,000 per fiscal year is the phrase in the application, which is what we're bound to. But no award from this grant program. The SMU and the programming grant funds are not the same
Mm.
Right,
grant. So
Right.
that means it is at our discretion how we want to split those up if there are dual requests across the both funds.
right, because Health Imperatives would be an example there.
It just means no single grant agreement
Right.
can have a maximum value that exceeds $100,000. So since those are two separate
Okay.
grant agreements, we're flexible on
All
that.
right, so I'm just gonna read down what I have here. So Lee is Safe Place, Linda Artist Association, John Elder Services. Joanna Health Imperatives, Suzanne in the Herd, Suzanne Lighthouse School, I'll do Pascon. John has the residents at Sherburne. Lee, I have to write better.
I have them written down as
Lee,
well.
Lee is Small Friends, Linda Starr, I'll do VNA, and Joanna Warming Place. Okay, so we all will read the grants, but I will look toward the people that are here to give a little bit deeper dive on that. So that
What's
goes,
the- Remind me what the red starred stuff is. Why is
Yeah.
it red starred?
Those are the operational grants.
All right, so you
those are
just
the
put them
ones-
on one list. I got it.
Yeah, because it's all coming out of the same funding pool.
Right.
That's the reason why they're on the same list. Sorry.
so Elder Services applied for a operational grant too?
Yep.
Okay. Alrighty. Okay, so.
It's not who we expected.
Exactly, but you know, it's perfectly fine as long as it fall in the category. So that's for next week. We will have interviews again. We're not requesting everyone to come in for an interview, except if you're a brand new organization. The capacity grant folks we're having come in. If we have no questions for them, they're not gonna be required. But we also will make it clear when that invitation goes out that attending or not attending has no bearing on the outcome of the grant. And those interviews are gonna be on November 14th, and that day it's gonna be from 9 AM to 12 to accommodate all of the interviews. And At the end of today, we will have questions for those organizations. And for the next 3 weeks, we'll have questions being submitted. Council for Human Services, are also, we have some of the members looking at some of the grants, and they may be submitting some questions also. So I think that by the time we're ready for interviews, people will get the questions that we have in advance, so we should have enough information to have a successful deliberations. And that brings us up to deliberations. I believe what we need to be working toward is having full participation in deliberations, and a minimum of 5 members of the 6. So if someone can't make it, we can still function, but we need to have 5 members. And it would be great if we have all 6 participating in deliberations. If we have all 6 and it's a even vote, we need to come up with a mechanism for breaking the tie. Last time, what happened when we had that, we basically had more discussion and a second vote because we had a split even vote. If someone can come up with another suggestion on that, I certainly would like to have some discussion.
So an interesting thing just occurred to me.
Okay,
The language around the NPDC member includes the words "or their delegate." We could ask if no members of NPDC are willing to do it, if there is someone that they would be able to put up in their stead to add as the 7th member of this committee. I just now thought about that for some silly reason. I'm gonna reach out and follow up on that. But it needs to be something, but in the case of a tiebreaker, it should be there should be I mean, we can go back and try and do the vote again a number of times, but at a certain point, there needs to be essentially an odd number of votes.
right,
And we need to figure out how to get to that. And how do we resolve tiebreakers? Which is what you're talking about. I just had
Right,
the thought.
right. Because what happened when we were faced with this back in June, we had 4 members that were voting. And the first vote, it was split 2-2. Second vote, we got a 3-1. So then we were able to go forth with a recommendation. But it could potentially be that it is
Deadlocked.
deadlocked.
I don't foresee anything where we can't work it out, though. I don't see anything that's gonna be, cast in stone. I'm not worried about it.
Okay. All right, just wanted to throw that out because it's been bouncing around in my head of how to improve, and I think, we cannot do deliberate. The more people, the more members that are participating, the more views and we get. So
And the more
we
we-
cannot, I think a minimum of 5 people, we have to do that, and if for chance. When it comes to the meeting, we may have quorum with 4 people, but we cannot do deliberations unless we have a minimum of 5.
Since that's over and above the regular guidelines and minimums for this, I think it would be a good idea for us to, if we want to have that be our official policy, maybe have a motion to be like, our deliberations will consist of 5 individuals, and if we do not have 5,
Then we need to
Reschedule.
postpone, reschedule until we have a minimum of 5 in attendance.
Is that something that you guys
Yes.
are amenable to?
I'm
Yes.
not,
No?
because a quorum is a quorum is a quorum, and that's Robert's rules.
So then I think that's a good
Say
point.
what
We
you
can
want.
hold the meeting. It would be, in this case, we would be making like a recommendation that we have at least 5 members for
Deliberation.
deliberations.
But what's the quorum for a regular?
Quorum for regular
There's only
is
4?
2/3, so we have 7, it's four
Okay.
So
people.
we have 4 people.
I mean, hopefully this situation isn't gonna come up, and hopefully we're gonna have
Right,
a delegate at the very least from NPDDC. And I think that's kind of, in that case, it would be remain an informal thing that we're aiming for. If there's no motion, no carried motion on having 5 minimum, and that would just be like stated best practices. It would mean that we would still be able to,
mhm,
just would be not our preference to do so.
mhm.
Okay,
Okay, so we don't need to do a motion then. Okay,
No, I would be adverse to making any motion about requiring more than a quorum. If we want to set a policy that it'd be a great idea to have more than, to have 5, that's great. But you can't make anything that's, that supersedes quorum.
and as a practical matter, us voting on a policy versus us just saying we have a policy there's no functional difference there. So
Okay.
I'm sort of with, I can kind of see
Okay.
where Linda's after this.
alrighty. Okay. I think that's it that I have to discuss on that topic. So now we can go into, if there's no other comments, we can go into the next item, which is reviewing the substance misuse grant applications. And we received a total of $321,000 in request, $475,000. So, you know, as with the other area, it was almost double. This is approaching that too. So, we are not going to be able to award everything that everyone has asked for. But this is where reviewing these comes into play. So, we might as well start with number 1, which is addiction solutions. And it's basically, it's their Nantucket clinic that they are looking to fund. And even though it's interesting, because even though we didn't say, that the capacity grant can really be used in substance misuse. Basically, when I read it, I was very impressed with this application. It's the best application we've ever seen from Addiction Solutions. I think they have taken our suggestions, and I think somewhere in here, they even wrote that the suggestions that we have made over the last couple of years, they've taken to heart, and they have made improvements to their organization and definitely with the application. They are, you know, they talk about their success that they've had. And, you know, what I see happening here is the organization is definitely expanded from just being, you know, good doctor and, you know, an assistant to a, hefty organization serving a, very desperate need on the island.
They have also added some expanded services in the last couple of years. There's an increased focus on wraparound and behavioral health that's not direct medical, which is something that this body has been asking them for a few years.
Suzanne, do you need me to resend it to you?
It's more that she.
No, I just can't get on the Wi-Fi here.
Yeah.
So,
Yeah, definitely they've expanded their clinic hours. They have added in, clinical social worker, which, in the past, and that's happened this past year. In the past, we had always encouraged them to, their clients to be referred back to Fairwinds, but as I've learned more and more of how they do and what they do and their clients are fragile. And they have a relationship with Addiction Solutions and to send someone elsewhere to share. It just, what they're doing is the way that I think is more effective. And, for looking at the client, it's the most effective way of doing it. Anyone else comments on the grant application?
I agree with you. I mean, I know I'm new to this, but I thought the application was impressive and very specific in terms of how they intend to use the money. So I thought it was the best application.
Yes, yes.
My comments
And
are
it-
they've come a long way, Veronica. You and I and John have seen them from the very beginning. And
Yeah,
they've
But
just completely revamped themselves into a much more of a professional presentation and an organization.
exactly, exactly. And I think even though you read between the lines, what they're doing is, Dr. Tim is, he has said it very clearly that he never plans to retire. But at one point, he may not be able to function on the same level. And they are building succession into this because this started as just an outgrowth of his practice and what he saw. But he also has another whole practice that he also does, and the need has grown, and I don't see this need going away in any respect. One question that I have that I would like some clarification on, when they talk about their, now I should see where it is. So it's on page 4, where the emerging and synthetic drug trends. The last one is misuse of GLP-1 drugs. And they have a little explanation there, but I would like a little bit more, if they can give us a little more information on that, because everything else there, I from what I've read and aware of, but that just jumped out because, of course, we know GLP-1 drugs are almost given out like candy now. And they're seeing clients that, so that just,
So we actually monitor these in the wastewater.
right,
And then we also have some other indicators. I haven't heard about the GLP-1 as for off-label use.
right.
I'm also not familiar with Chinese transnational criminal organizations producing high potency marijuana, but I will definitely.
How do the people misuse that GLP?
Yeah,
That's, I think we're really good.
yeah,
That's-
that's right. So if we can add that for a list of a question for them, and I think I would like, even though if we don't have many specific questions, I would like to invite them just because of the dollar amount that they're asking also. That I think
Yeah,
we would like to
yeah.
have them come in.
Yeah, we could just ask. We never have to give a reason to not ask somebody, basically. Yeah, I think that's a solid idea. We'll get those, so we'll propose the question of, like, could you expand on some of the misuse cases of the GLP-1s?
Right. And the other thing that, and I know that this has come up with their applications in the past, when it gets down to page 6 with the organizational data, I didn't have an issue with, but with the program information, when they talk about the program reach, I know their numbers are, they're counting
Social media impact.
social media impact or whatever, and that's wonderful. I'm not downplaying that, but it's almost like how many clients are they serving? I'd like to see that
may I suggest a question for them?
Yes,
How many unique guests or unique patients do you serve per year? Because I think that gives us the number of how many patients are in there directly receiving services in a given year.
right. Right,
To my knowledge, that number has fluctuated and is still hovering around a fairly large number.
mhm,
I also would, so one of the things about Addiction Solutions is that it relies upon Dr. Leprey's medical license to operate. So one of the things I would like us to discuss with him is that succession plan, that contingency planning around whether or not, like what happens to the organization,
Right.
should that situation change?
and that's where, Dr. Armstrong,
So Dr. Armstrong is a huge and tremendous
Yes.
advantage for them, but
Yes.
she's also not going to be she's not the medical person.
she's listed as on the staff. And she is the clinical, the medical doctor, so she is listed, and
But-
she's part-time.
Yes, agreed. I do not believe she would be succeeding Dr. Lepre should he retire. That's sort of where like it's based out of his office. Like, so it's his medical practice that is the medical umbrella for this organization. So us figuring out ways to supplement, expand services and help them do succession planning would be, it's not even succession planning, but like just contingency planning, redundancy and adding additional services, both wraparound and other medically assisted stuff would all be things that I think are like the next step of what we've been working on them with over the last couple of years. Because Dr. Lepre will do this for as long as he can.
Mhm. Yeah, and I know, yes, we can ask for clarification on that, but my understanding is that's the role that Katerina Armstrong. And bringing her on board
Was that part of that transition?
was
plan?
part of that transit, but we can ask for clarification on that, for sure.
Yeah, just so I understand it, at a minimum, they need a medical license in order to operate. Am I right about that?
Mhm.
Yeah, okay.
And I believe they also need a insurance reimbursement mechanism.
Right.
And then they also need, there's some due diligence that is necessary. There's certification for information handling, and then they need to be able to order and store drugs, because I don't believe the hospital stores the medically assisted treatment, medicine.
Right,
They
Right.
don't need insurance. The
Yeah.
normal insurances that would come along with a medical practice, right? Yeah.
Yeah.
right.
It is tremendous that they're adding social work to that, and we definitely want to support that.
Yes,
And we want to make sure that there's plenty of, like redundancy built in
mhm,
to that, because that's half of the clinic staff is his medical clinic staff too as well, so there's
Right.
like lots of crossover. And that is good, because you're getting treatment from known people that you often will get medical services from as well. But it's like just long term, if we're investing this much into Addiction Solutions, we want to make sure it's a solid and a long term, because I want that to be the primary
right.
treatment source on Nantucket.
And, you know, beyond the clinical social worker, there is something in here, they are doing outreach also to Warming Place. So, you know, they're in process of building initiatives led by Aileen and social worker to have that closing that gap. So, like I said, I'm extremely impressed and, you know, 100% I would want to support, you know, their efforts, and it's they've come a long, long way in a very short time. And, you know, what started as just a outgrowth or an offshoot of his practice, I applaud his insight to build this whole separate practice. And, you know, when we've heard stories of their client base, it's not necessarily the individuals that I assumed. You know, they have people who are functioning in life because of what they're doing. And it's people who are able to work, able to manage families, and responsibilities, and it's due to, their support and effort, so.
It's worth noting that he did this 10 years before it was commonly accepted, and then he, like, this was a much needed program that was not at all here until
Yeah.
this happened.
Yeah. Lee, I'm just gonna make a suggestion. They talk about the boy next door. I think that you can find that, I don't know if, you know,
It was,
that-
it's fabulous. I saw it.
okay,
I
Good.
think it's on NCTV YouTube maybe.
Yeah,
Oh, they're gone, right?
Yeah, I think
exactly.
so.
And, that really, you know, it was very well done and,
Yeah.
so puts it all together, so. Any other, comments? All right. Okay. So we'll go on to the next. And now
This is
it's
the,
Community Solutions, who is, I guess, the 501.
So in a similar manner to MAST and ASAP's relationship in the past, this is a for-profit company offering services on Nantucket through a grant support, with the fiscal agent being Community Solutions for Behavioral Health. They're offering, the Hope on Act program is a type of behavioral health procedure that involves using transcranial magnetism to induce changes in neurochemistry similar to psychopharmacology, that is then used along with some other therapies. It has some other talk therapy. There is a pretty extensive scientific literature backing its efficacy in some cases that's very dependent on protocol, but to my knowledge, no one has ever done it on Nantucket, in any capacity.
Okay. Does anyone have any comments on this application?
So I know,
Zooming.
I'm zooming.
Okay,
I got it.
Okay.
I muted him.
all right. Anyone else have comments on this?
I didn't get to read their, number 3, the description.
The description of his program.
Neurofeedback, yeah.
The pilot is an in-person program that integrates lens,
Neurofeedback with
with
structured
structured-
psychoeducation to reduce stress reactivity and cravings while strengthening relapse prevention skills.
Oh, okay.
Services will be delivered weekly at the Summer Street Church offices at 4 Trotters Lane, a central, familiar, and wheelchair accessible site. Each participant will receive a 20 to 30-minute individual lens session paired with a 45 to 60-minute small group module that covers stress physiology, trigger management, grounding and breath work, sleep and nutrition and recovery, and crisis planning. When weather or unavoidable travel disrupts access, telehealth check-ins will be available to maintain continuity of care.
Okay.
It's-
yeah, I was just gonna comment, I read this one and I just don't know if it's appropriate, but is there any, is it appropriate for us to ask for, I'll just call it backup, some research? This one, struck me as being new, just as a lay person in terms of what they're doing. Not opposed to it. I just it just seemed really new in terms of the therapy. I just don't know if it's appropriate to ask if there's any scientific
It is.
upper
Oh, it is.
research.
Definitely. And
Always.
that's one of the big thing. There's, I I Googled and I tried to, find information. I know that this is happening, but there really was no backup in the application of,
So they do have a supplement that's in the main application, the programming application, that has a pretty extensive scientific bibliography and a extended breakdown of what this therapy is and where the evidence-based backing is. I'll excerpt that and I'll send that around.
okay,
But there is a pretty significant literature for not this particular protocol, which I am not familiar with.
Right.
This looks to be cognitive behavioral therapy, group
Right.
session and TEMS. But this has been used for treatment-resistant depression in the past.
right,
It has been used for a variety of substance misuse and PTSD. It's often used in places where psychotropic therapy is not legal, because it has some similar effects on altering kind of cyclical behavioral patterns, in the same way that sometimes psychopharmacology can as well. It is the rest of the application, the supplementary appendix that they put in, really does dive possibly too deeply into this, and I'm happy to excerpt it from the program
Okay.
when it's sent.
but I guess this brings up another point that we need to look at these, just as this application, not reaching back to the other application that we
Agreed.
did and bring it over. So I found this application was very much lacking. There's no budget numbers here. You know, except saying, 39,500 and with in-kind contributions valued at almost $18,000, but there's no numbers. And the numbers, we have a beautiful breakout of the budget for community solutions and behavioral health, but that has no bearing on what they're doing. And I understand why they've attached that, because that's the holder of the not-for-profit status that they are gonna function under. So we have that, and that's wonderful. They've got beautiful, budget there, but there's nothing here except 39,500, and
Or how they're gonna use it with the opioid misuse one?
right, or just what they're gonna do with the
Do with it,
money.
yeah.
So I found this application very lacking in, the therapeutic backup. Does it really give me any sense? I know it's a new organization, and I know we want to support new ideas and efforts or whatever, but without any financials. So if I looked right now without getting any more information on this, when I sit down and I look at the rubric, they would not do very well, because there's just,
Not enough information.
it's well written, the writing style is fine or whatever, but it didn't have the substance of, that we should really, have.
Erica, can you bring it down so I can see?
Yeah.
Yeah,
So I think this might be an artifact of the application process,
This
because,
is the next, you're in the next one.
Oh, where do you
Go
want us-
back up to.
to the actual thing.
Yeah,
So there's,
Suzanne, if you want to sit next to me, I can share if it's easier to do this.
well, it'll be hard to read it. It's okay.
Okay, all right.
Thank you.
so there's some information that did not make it into the SMU packet, basically, because it was outside of the formatting of the app, like the
Okay.
Exhibit D. We can only work on what we have in
Right,
the application. That stuff is in the programming one, so when we're discussing, I guess, that request, we can look into it,
okay.
but
So I think a question for just looking at this application, because we need to look at them completely independently. We don't want to, this isn't an addendum to the other application. So, we definitely need, a budget and, how this money is going to be spent. And I also, there's a discrepancy too, because on the cover page, the grant request is 49,200.
that is a mistake, it's 3.9.
Okay. So it is 39.5.
Yep.
So, you know, that's an error. And, you know, I don't want to be a stickler, but, I've also, all these conversations that I have inside my head, you know, when you fill out an application, we've made efforts to improve the application because at the end of a grant review, what was lacking, so we know that maybe we need to ask it better. And I think that we've improved this application, but if you cannot follow the directions on an application, what does that mean that when you're actually running a program, or could they be trusted that they're going to be able to administer the program if they're not following directions here? So, and I know that is one of the rubric
Categories.
categories, and
Category.
you know, looking at this, it supports why we use that as a category of looking at the grants. So right now, we need budget information. If there should be backup for specifically this application.
I have that and I'll share it around right now, but it's not germane to our discussion.
Okay. And we definitely need them to come in and
Oh, yeah.
explain what
And
this is all about.
any new applicant has
Yes.
to come in, and especially this one, because it is a completely new behavioral health technology.
Right. Okay. Any other comments? Mhm. Okay. So next it is health imperatives. For their harm reduction program, and they're asking $50,000.
I think this is an expansion of their existing programming that they have been doing often, like they've been doing pretty consistently, through our funding here. There is zero complaints about them as an organization on any level. They are one of the most effective utilization, like most effective delivery of services for money of anything on Nantucket.
Does anyone have any comments?
It's well run, all encompassing. We'd be up a creek without a paddle without them.
In like 5 different ways.
Yeah,
Yeah.
5 different ways.
I agree. It seemed like a solid application. They seem to do very good work.
Question I have, and it's just that there have been so many efforts on the island for distribution of Narcan. And I believe, and I should have made a note where I saw it in the application, that they have not distributed as much as what they had anticipated. And I think I would like them to just add something to that, because I know that there've been many efforts on the island. You know, I think every
Rosemary.
from, you know, has been doing lots of distribution. There's been training sessions. I know that emergency workers all carry it now. But the fact they made a thing that they have not distributed as much as they have, and there also, and there was some discrepancy, I guess on, opioid related, deaths.
This section here, despite the declines,
What page are we on?
that would be 27 of the packet.
Have we had a sharp decline or just?
The state
The
has had a
state has-
massive
Yes.
decrease.
Okay, is it number 6, so it's page 25. Yeah, the sharp decline in opioid deaths. And I know that there has been a sharp decline. And I think, I'm not sure if they said that there were 4 on island, and then there's somewhere else that I read that there were 8 on island this past year, so there was a little bit discrepancy. Yeah,
I don't, I
yeah,
know that yeah, no, from what I heard from, Officer Mack, though, this was June or so of this year, we had no.
the previous
The
year
previous
there
year
had been none, yeah,
As far as I remember, the statistic for state of Massachusetts was a 90% reduction in overdose deaths, but not a sharp decrease in a mild decrease in overdoses.
right,
So basically, the survival rate is generally attributed directly to Narcan.
Narcan,
That's because of the survival
Narcan,
rate
yeah.
there.
Yeah.
I don't know, off the top of my head, I don't, we need to get better at figuring out a safe way to monitor and share that information
right,
without having any kind of identification, like managing it properly for release. But I think we can get I can see if I can get a confirmation for that number, but what would you like for us to ask? Like, what do you attribute the reduction of Narcan distribution to?
yeah. Cause you know, if you look on page 24, so in fiscal year 25, 266 Narcan hits
Oh,
and
that's
310, and then for 26. Now I know we're only maybe I've just answered my question. So fiscal year 26, we're in fiscal year 26, so they basically reported just on 2 or 3 months of the year, so that's where it's 20.
And their anticipated program.
Yeah, quarter one, okay,
Yeah, and their anticipated reach for the year that they're applying for is 250, which is roughly around where they're seeing for the program reach
Okay.
this year's.
all right.
Couldn't some of that also be attributable to the availability of the Narcan from many other sources?
Yeah.
That was also my question.
I would assume that it's a safe bet. It should be available over the counter for, if not free, almost nothing at pharmacies. Obviously we'd want to confirm, but I'm pretty confident that it is everybody. More Narcan is being distributed in total on the island just by more different partners and in different places, which hopefully means it's getting into more different populations that didn't have access to it in the past.
Right, right,
I think this is one of the unambiguous successes in behavioral health for substance misuse over the last couple of years. It is incredible how many people are alive because of this and this distribution.
I have a question. Are there any figures or any studies like that these programs go on to say? In my mind, I'm going, is this, are people taking more chances because they know they have Narcan? So how does that reflect with people maybe getting off of opioid misuse? Do you know what I'm saying?
We've done, the health department, I've done a couple of looks at this, and there's a broad consensus in the public health, like epidemiology, specifically the opioid epidemiology crisis, that the rates of overdose did not substantially increase. They're about the same as they were before Narcan was generally available. Because Narcan does not increase the number of overall overdoses, but reduces the deaths, you can't really make a causal connection between Narcan availability and people taking more risks.
Okay.
this is sort of like a first aid
Yeah,
approach, it's a Band-Aid on the bigger picture of the substance misuse.
it alone will not reduce addiction. And it will not reduce people being using drugs, what it will do, and this is just a statistical artifact, everyone who dies from an overdose cannot attempt recovery. So anyone that
Mhm.
survives, no matter what the percentage, increases the number of people who will end up in recovery. But it does not seem to lead directly to increased usage rates. And that plus other harm reduction techniques like the fentanyl testing strips for mixed drugs, for purity testing. There are services that allow you to call and have someone be on the phone with you while you're using in order to be there to alert emergency services if you overdose. The greater acceptance of a partially clean into like the Dr. Lepre medically assisted therapy as a bridge part.
Mhm.
All of those things together add up to significantly increased survival rates and then reduction in usage in given populations.
Okay.
It's too early to tell on a population level if this is going to lead to more number of opioid users. But it is, at least on a first aid point of view, it is an unadulterated positive thing. on that.
Yeah.
It's a super interesting field to talk about, like.
Yeah,
Yeah. And I think what comes to mind is that when we look at all of these applications, substance misuse is a very complex issue. And, you know, Narcan, I think, I look at it as it's like the first aid just to bring back, but that's not where it stops. That's where, you know, if that's a wake-up call to go into a next level of some kind of remediation. I know that's not the proper word, but and you know, and it's not a one size fits all. And that's why I think as we as a population of becoming more aware that it's not just a medical approach, the psychotherapy, but then where we've seen tremendous results where that introspection, meditation, breath work, and now maybe the electronic lens. It's I can, yeah, my previous life I dealt with tens, but this is lens, you know, this is lens, you know, whatever. So there's it's a huge issue in our society and on our island, just looking here, and it's not a one size fits all, but the Narcan is the first aid that at least will get the person here to maybe take next steps.
And I know Health Imperatives does do forward referrals to other agencies and organizations. So if they sort of similar to Family Resource Center, sort of similar to a lot of the church groups, are kind of hubs around which a lot of other services go through. And they originally got into this harm reduction program because it was a need that emerged in the Planned Parenthood and WIC administration that they were doing. This was something they moved into because they had discovered a need, and they were trying to address it. And we had the Substance Misuse Grant Fund start right at the same time.
And, you know, Lee, just, you know, for your background, they are the organization on the island that successfully reaches some of the immigrant population and the non-English speaking population more effectively than almost anybody. So, as our population has evolved or whatever, they have filled a great need. And not just for the immigrant population, but for the underinsured population too. So,
I think that's an important point. I'm just curious,
Yeah.
does anybody have a sense as to why that is? Is it the people working for the organization that have a better connection? What seems to be the reason for that?
That's basically it. The previous program director, Sonny Daly, who's now at the Community Fund, just hired from within a variety of communities that are not usually hired from. The language
agility, basically, then kind of facilitated increased outreach in that area. Then I think it went from the Planned Parenthood contract to the Combined Health Imperatives and WIC
With
program. Once they started administering WIC, that ends up being just women and children, the women and children kind of component to that naturally connected them with, as like receiving referrals from the hospital around kind of any maternal issues, and then making partnerships with the VNA, who then also has direct connections with them. It was a basically, yeah, basically like holistically.
Also, just as a further background, when they came to this, going back several years, they had the most effective off-island organization, partially through extraordinary leadership. But so they came with a structure which they then were able to apply to Nantucket, having administrative capabilities and experiential capabilities. And then they had the extraordinary person that they had hired who really personally fit both that mold and the ability to reach into the community.
That's great.
Yeah, and you know, they became like the Planned Parenthood on the island, and their outreach in that area, and it actually is a safe place for, you know, LGBTQIA plus youth, that they know that they can go there and be tested and get services or whatever, and, you know, no questions asked and no judgment. So
Basically time and hard work. That's
Yeah.
that's how they
Yeah.
managed it.
yeah, and I know that as an organization, as with all of our organizations on one degree or another, they are feeling the effects of changes in our federal government attitude and where money is being spent. And I know that they're taking a big hit because you know, just because of some of the services that they provide are not necessarily in the view of a more conservative government that we have right now. So I know that they're aware that funding is going to be changing. And I guess in just a conversation I had with Julie Kehoe at our event back in September, she was very stressed on what they're dealing with their organization, which basically is from Brockton down through the Cape and the islands. That's what their catchment area is. She assured me that, you know, Nantucket is not going to lose services, you know, even though that, you know, they know that they're going to have to look for other sources or whatever. But, you know, she ended the conversations, and I will make sure that Nantucket doesn't lose any of the services, even though we're losing funding in many areas. But
And I think they and Elder Services are unique in that they have already had funding clawed back by the federal government.
Right.
So it is not a future deficit that they're looking at. It is a current deficit.
yeah, yeah.
I wasn't aware of that. So in addition to stopping funding, you're saying in some instances they clawed back money?
So I know the federal government between I want to say June and September with ahead of the release of the federal budget, there was already allocated money that was either failed to be dispersed or that was required to be returned from the states that would have funded part of their programming. That had knock-on effects onto the state budget. That meant that already allocated funding was not dispersed. I believe there were a couple of lawsuits that Health Imperatives was involved in, although I don't know the specifics of those. That I do not believe that, I believe that they did not win those, and that they had a budget deficit between the close of like already once this calendar year, they had a budget deficit.
Wow.
I forget how it lined up between the state and the federal budget. Like there was a gap between the release of the Massachusetts state budget and before the federal budget was released, and already allocated money was returned, was requested back without really an option to say no.
Well,
Yeah. It's a strange world we're living in, that's all. But, you know, their applications are always, very thorough and complete, but, you know, when you look at their overall, Nantucket is a small portion of what they do. And, you know, we have uniqueness because of our, isolation being 30 miles out in the ocean. And, but, you know, Lee, just as a point too, 2 years ago, they were noted on a national level for a program, the WIC program, that they've been successful on the island. And they were recognized nationally for the program and their numbers and their success, that they were trying to see if it could be duplicated in other areas. So, you know, it was nice that usually, you know, we're like an, oh, by the way, but Nantucket, you know, and what they've done, was recognized nationally.
I think
So,
that's not like the model best practices for that particular service delivery method, which is
yes,
a big deal.
a big deal, you know. All right, so, with no more discussion on, unless anyone has any comments, we can move on to NAMI ASAP, which is Sustainable Tools for Adult in Recovery, asking 31,000 change there, and it's on page 34.
Go.
Any comments?
I mean, this is a pretty solid, like from the HHS perspective on this one, this is a pretty solid program. It's by known agencies and individuals. It covers a gap that we've been sort of supporting in a couple of different ways over the last couple of years. It is specifically what I personally like to see in a lot of this, which is tools and techniques that have wide applicability in a variety of different contexts.
Mhm.
And then it's not a huge, like it's based on what their projections are, it's not a huge ask for what they're hoping to deliver.
Right. You know, just a little bit of history on this. This was first, came to us when we did the youth behavioral health grant.
And I think
The collaboration between NAMI and MAST at that point.
we had the breathwork and Frisbee League,
Yes,
and then this ended up being the runaway success out of the two of that.
exactly. And, so ASAP, and NAMI, ASAP has now been incorporated into NAMI. ASAP still exists on the island, but it all is now funneled through NAMI, so the application, you know, is NAMI, but this application was done by Elise Norton and,
Susie Tapley, I think, who's she consulted on with Elise on the MAST side. That's the principal.
Right. Right, the principal at MAST. You know, just some questions I had here and, you know, we had to do the math that it was like 216. But it's basically, they're talking, I think, 18 individuals will do a 12-week program. And that's where the 216 number comes into play.
That's individual encounters.
Individual encounters, you know, so it's like, okay, I understand. So it's 12 consecutive nights and
Yeah, you know, visitors.
yeah. And then they are gonna do a live stream on this too, which I thought was interesting. And of course I looked and it's like, well, $1,700 for technology for live stream. And I thought that was a little, you know, what does that mean? But it could be for a streaming service that they have to pay for. So I have a question that if they can just explain that.
See specifically, where was that budget?
Yeah, it's on the page 41.
Technology for live stream 1738.
Yeah.
Has anybody gotten some personal feedback on this? Is it a success? Are people talking highly of it?
Honestly, the success that has been shared with us was done basically through the Youth Behavioral Health Grant. The person who was doing that in the schools had extraordinary results. And I remember being in a environment with Dr. Lepre, who comes from a medical approach to substance misuse. And when we shared the results that happened with basically teenagers, and he was in amazement that that was done without any kind of a pharmacology intervention. And I know from one of the practitioners on the island who shares his story that this practice basically saved his life and completely, he basically said he would have probably died 6 years ago. And in that time, becoming a practitioner, number one, working on himself, but then learning how to share this, it's extremely impactful. And not everyone chooses whether it's Alcoholics Anonymous or a 12-step program, or medical assist with counseling, etc. So it's another avenue, and the way that they're looking at this, it will be in conjunction. So they are going to be getting referrals from Addiction Solution, from Fairwinds, from AA, Dharma Recovery from the hospital. So it could be another tool for.
It's honestly it's probably the second. There's 3 ways I think of to look at its efficacy. Individual testimonials, it is the second, the umbrella of mass delivered wellness programming is the second most requested or individual outreach supported program we've ever funded after in the herd. Then the teacher wellness program that we funded in addition to after the youth behavioral health was like it was the most requested and registered for class that they've had. And something that they're trying to, I think even they're trying to duplicate or supplement that with some of that Lighthouse. I think some of the Lighthouse grant requests is including similar to behavioral stuff. And then there is very good evidence supporting this at a population or statistical level. There's been a lot of fairly large studies showing that it has about as effective an impact as a large number of prescription medication and psychopharmacology.
Something I read recently just with looking at meditation, and if you practice meditation over a short period of time, there are changes in brain waves that is documentable. So, 30 years ago, this would have all been looked at as hocus pocus, and I think that the medical community is starting to embrace, you know, these different modalities.
Well, it's whole health, it's not just the body, it's the brain.
Exactly,
It's-
exactly.
It's also as efficacious as significantly more expensive medical interventions, if
Yeah.
not more efficacious. And I think a large interest in it is that it is not delivered in a clinical setting, that it is delivered in a more human way, I think.
Yeah.
And that it is not quite as closely associated with like the medical industry, which unfortunately, but understandably, is not super popular at the moment.
Right, right. You know, just as an example with Reiki, there are many, you know, licensed practical nurses or, you know, RNs that, are trained and have become Reiki, practitioners and administer that during, treatments. So, it's, you know, the world has, you know, definitely evolved, as Suzanne, you said, it's not just the body, but it's the mind, and that is,
Body, mind, spirit, the whole thing, it's all connected.
it's all connected, so, so that's, you know, where we are with this. So any more comments on this application?
No,
And then we can go on to ACT ambassadors with NCTV.
Jericho, I got on the internet,
Why now?
and I had to go in and change something.
Okay, so here it is, ACT ambassadors for this branch stream are asking $100,000. And this is a program that also, the first time that was brought to us was with the Youth Behavioral Health Grant. We funded not $100,000, but we did fund them to start this program. No, I'm looking at this and, you know, this is a case where this is, you know, when we discuss, some of these grants are for treatment and some are prevention. This is definitely in that prevention category where everything else that we've looked at, well, the lens, I need to learn a little bit more about that, but health imperatives, ASAP, addiction solutions, it's more treatment. This is prevention. The person who they have running this, is very dynamic. She's done some,
Stephanie.
yeah, she's done some great things, pulling together all the resources, so it's not just, you know, the technology of having, you know, cameras and, you know, having people stand up and tell their stories. It's backed up with, you know, support services, etc. A question that I have for them is where, after this is done, and I understand that the benefit for the individual participating in this, but where is it being,
And where does it end up after it's?
where does it end up after? And, you know, I see here, you know, the toolkit library will formally launch, you know, multiple NCTV Channel 8, classroom, and intentionally curated community-wide settings, but it's a lot of, I think that there's something good happening here, but after it's done, what more?
Well, it's my understanding, and I've seen it, I'm also a member of NCTV
Okay,
as just a lay person. And so anyone can use the materials there, the equipment, but these programs are set up so that specifically the kids learn the production, the editing and stuff, and the outcome, they make movies. they actually, you know, have a product an end product. And I've seen them get very excited about continuing, you know, so I think it's just one of those prevention programs that is, once they get involved in it, you know, they keep going.
Yeah.
They want to each year make a new film, you know, that kind of thing.
Yeah.
You know?
And I think
I was gonna say, I think the production part is fantastic. I was just curious, are there any metrics as to year over year, how many people actually watch the programs?
Yeah.
I'm sure that they track that in some capacity. We
Yeah.
can reach out and
Yeah.
ask.
We should add that as question. Cause that's my question, you know, I don't question what they're doing, and I think it's a wonderful thing for someone to stand up and tell their story.
Right.
And to tell it to a camera is extremely powerful, but what more, you know, I'd like to know metrics, where is it being shown, what is how, numbers, what happens afterwards?
Well, it says under number 4, that in the last paragraph, that it aligns with future curriculum that NCTV intends to introduce to the public schools, Lighthouse School, New School, Our House, and the Boys and Girls Club for integration in health and wellness education. So it's being distributed in that peer group.
Right.
Yeah.
Right. But I'd like to, you know, maybe a little bit more about how that's gonna happen,
Okay.
because, you know, getting something into a curriculum is, I think maybe on the island it's a little bit easier, but you know, we're dealing with bureaucracies, et cetera, so, I'd like to know a little bit more.
And I know they do this alongside some other similar, like alongside Dreamland Foundation, they do a lot of these personal narrative, personal story, and
Yes.
it's like stage and theater and film. I really think whenever we can, we should be supporting it. Part of addressing stigma about behavioral health and addiction issues is making the response to them normal, natural, and supported. And
Right.
art has been a way for people to deal with their issues basically since it was invented. So we have the luxury of being able to support that to an extent in this town, and we should try to do so whenever possible.
Right, and we've had some extraordinary programs and results that we can see, but you know, this, once again, this is purely in prevention as opposed to treatment, and you know, I know that at the end of the day, if we only have this much money, we're gonna tend to give more for treatment, but we need to make sure that we are also addressing prevention. You know, easier maybe to change behaviors before it becomes an issue.
What's the line about an ounce of prevention is worth a,
Pound of cure.
Yeah,
Agreed.
yeah,
I'd rather prevent them from doing it than have to treat them after they do it.
Yeah.
exactly.
Yeah.
Exactly, and, you know, this basically is, you know, are they just looking at youth here? Yeah, I guess the
Yes.
population that they're going in, it is just youth.
and they have a great advantage of being directly plugged into referral and communication with the school, and then immediately having more resources than any audiovisual club has ever had.
Has never had,
So-
exactly, you know, it's fabulous, you know, it's one of the wonderful things of living on Nantucket, and even with all of the rural nature of our environment, we have some incredible talent and resources, and like you said, there's more here than any high school audiovisual club could ever have.
Mhm.
You know, and it's by funding something like this makes it accessible to more too.
I liked their breakdown of how are gonna use the funds too.
They've
It was
consistently
pretty comprehensive.
Yeah.
been good at the nuts and bolts of applications.
Yeah,
Yeah, I'm okay with the targeted audience, especially with the schools and the students. I think that's a really good thing.
Yeah.
And then they're happy to provide viewer analytics and social television for social and television platforms. So they likely have that information to hand. When someone requests that, they should be able to get it.
Yes, we can have that as a question for them too. Alrighty, any more comments on this specific grant? Or on the grants that we've reviewed this morning? All right, with none, we can move on. That just, we looked at the calendar, so next week it's program, weekend after that, on the 7th is operational. 14th, we have interviews, and the 21st, we do deliberations. Can we have an update on the needs assessment? That's our next.
Yep, I'll try and give the same information from yesterday in a different forum. Most important thing, last I checked, we are at just around 100 responses direct from residents, which is, we're already pretty happy with that. There was a significant portion of those were Spanish language. We will be, as soon as we get the schedule and recording done, we'll be doing some radio spots that will run all winter long, having people go to Act Cares to get to the survey online form. Then we have some QR codes. We're going to do some physical flyering at a couple of locations discussed. We're going to be getting some initial results from their background and secondary research right around when we start deliberations. So we'll have some initial statistical information from the first heavy survey submission period, and then so we'll have comparative data from other municipalities, and we'll have some initial focus and stakeholder group responses as primary research available for us during the deliberation process. We are on target to hit the statistical frame for this study, which is I think 387. We're on track to hit that by halfway through the year, and we'll be collecting for another three months after that. And then I'm gonna have some physical printable flyers that you can either hand out or post anywhere. We had a request actually right after that, the meeting yesterday, to provide like a physical printable handout to distribute. And that will have QR codes for the local survey and the seasonal worker survey in 2 languages. We're working on getting Portuguese sorted out and posted as well. And then it's going.
Right.
I'm hopeful we'll have Marcus back again in the spring for like the wrap up. And then he'll also be around to present the results of this to us, CHS, and then likely select board as well.
Okay, and just to add on to that, I don't think you said there will be radio.
Yeah, radio spots.
Radio spot happening throughout the fall, the remainder of the fall and winter.
Spanish and English.
Spanish and English, sending them to where to find the application to fill out, and it's all anonymous.
Yep.
There's no names associated. It's just a matter of getting data. And yesterday you said that we're trying to get about 400 to 500.
I think it's 387 is the minimum for statistical significance, with
Right.
some breakdown based on age, gender, et cetera,
Right.
et cetera. What I would be satisfied with I would be more than satisfied with 1,000 responses.
Right.
500 would make me quite happy.
Okay, just a follow-up of a conversation we had yesterday, the food pantry, you make a small
Yeah, that's
thing
okay.
with the QR code, English, Spanish, it'll be put into, people's, bags, and very willing to do that. periodically over the next bunch of months.
I'm gonna get, Lexi, if we could, let's blackmail Heather into making us a little flyer with the, for internal use, yeah. We'll get something together. It'll be easier on my end if I have a combined thing, like a span, like if I just
Right.
put all of it on one document for everybody who needs it.
Right.
And then we'll should I email it over to Ruth?
Ruth, yes, directly to Ruth. She's expecting it.
Okay.
Alrighty.
In worst case, we can just scrape the webpage and reformat it.
All right. Any other new business? With none? Can I have a motion to adjourn?
Make a motion to adjourn.
Second,
That's second, all right. By roll call, before I do that, thank you everyone for dedication to this process and we've got, I think, a lot of very good applications, and I think that it's gonna be an interesting outcome that we'll have. And the last thing before that we want to do, and we'll probably have that on our agenda for our deliberation day, is to prepare a request for funding increase for fiscal year 28 it will be.
Yeah.
But our recommendations are gonna be submitted by the end of December. And at that time, we also wanna have the letter for funding increase. So we're trying to get
Ahead, yeah.
way ahead. And so thank you all for your efforts in this. So on that note, let's do a vote. Suzanne,
Aye.
Linda,
Aye.
John,
Aye.
Lee,
aye.
and myself. Aye. Thank you. Have a wonderful day. Enjoy this beautiful fall weather that we have when it exists out here. All right.
You
And-
did.
Jericho, I need to
Linda, are you
talk to
up?
you.
Yeah, a packet.
Yeah.
We'll stay on right after I
Yeah,
stop
I'll
recording.
stay on. We'll talk about it.
Okay.
All right. Linda, are you up in New Hampshire or?
No, I'm in New Jersey cleaning out my uncle's house.
Oh, okay.
I'll
All
wait.
righty.
Right.
Best of luck on that, Linda.
Thanks.
All right. Be well, everyone.
Take care.
Have a great day. All right.